All right. Hello, everybody, and welcome to the live that I'm running tonight on health anxiety and how to bust through it. I have been procrastinating this live for a very long time, mainly because I know so many people go through it, and I haven't had the personal experience myself really struggling with health anxiety. So that's why I've asked Maddie to come here with me tonight. Maddie is one of my patients. She is one of my patients in private practice, and she has done peace of mind methods. So she's going to be able to answer lots of questions tonight from everyone if they have them. But I wanted to have her on here because Maddie came to me at the beginning with very, very, very high anxiety. And I think health anxiety was a huge thing for her to work through. And just seeing her on the other side of this, it's given me a lot of, happiness and pleasure to watch her grow, and also a lot of pride, because Maddie was one of those patients that came into me and was like, I'm broken. You can't fix me. I will never be well. This is going to plague me for the rest of my entire life. And I've tried absolutely everything and nothing works. And I am a disaster human being. And she came to me in total tears. And I sat there. I remember our first call, and I was laughing at you. And you were like, it's not funny. And I was like, it's funny to me because I can already see where you're going to be a year from now. And I see all the things that are missing in what you're doing. And I thought it was such a good opportunity for change, even though you were stuck in the hopelessness and the I can't see myself out of this. But I saw in you what I see in everyone else when they come to me, which is I can't do this and I can't fix this and I can't repair this. And I say, yeah, you can. We just have to put the work in the right area. So
Yeah.
that was my little preface, to why I've selected Maddie to be with me today. Obviously, it's not usual that I come on here with my patients. I have to get consent, and someone has to accept and want to talk about these things with me. So I'm thankful that you came here to do this with me today. So yay!
Yeah, for sure.
Yeah. For myself, like I know I told you guys that I never struggled with health anxiety. And I think the only time that I really can look back and say, yeah, that was a big part of my life was when I was in med school and I was learning about all these things and all the differential diagnoses and all the different illnesses. And it was such a smack in the face all at once to learn all this information and be like, oh my God, wait, do I have that? When someone coughs like this, do they have that? When someone gets a rash like this, do they have that? And it really, I was fixated on it for a very long time in my life. But obviously on my side of things, I have the medical knowledge and I know the differential diagnoses and I know the red flags that we're looking for in certain situations. And that became something that when I was working with Maddie closely, I was like, wait, I can download my knowledge to you and have you interface with the health anxiety differently by making you more intelligent and smarter in that area. And we'll cover
Yeah.
that later. But that was like I remember that being a big hallmark for us together.
Yeah. Yes, absolutely.
I'm going to give you a chance to tell your story. Do you want to do it now? Do you want to like give a little preface, even though I just gave my little narrative of what's going on with you? Do you want to share kind of where you were when we started?
Yeah, do you want me to start there or do you want me to go to the beginning?
That's up to you. Go to the beginning.
Okay. All right, so I am 26 now. I was diagnosed with anxiety at 12, 13 years old. Right away was put into a outpatient program, helped me tremendously. But I remember even from a young age being terrified of things like cancer. And it would consume me, and I would feel things, and my parents would be like, no, Maddie, like it's okay. Around the time that I got diagnosed with anxiety, um, I remember it specifically, like the turning point. We were on our way to my grandparents' house, and it's like an hour drive, and we were about 20 minutes into the drive, and I was like, you guys gotta pull over. Like I couldn't catch my breath. I was like, I'm gonna pass out. I'm dying. Like it was crazy. And anxiety isn't foreign to my family. My dad has it. So, but again, as a parent, they were like, this isn't gonna happen to my child. Um, and yeah, went through high school. Everything was great. Once I did that outpatient program, And then grade 12 hit, and um, things changed again. I was like, holy smokes, I'm going through a big life change. I need to figure out my life. Um, and I lost it. And for about a year, no, like really, I lost it.
I know
For a year.
I always think it's funny to hear you say I lost it because like it's a colloquialism that we use. And like guys, when Maddie says she lost it, like she fucking lost it. Like
Yeah,
Maddie losing the plot is as crazy as it gets. Um
yeah, yeah. And it was during that time that I went back to my doctors. I was already originally on medication. Um, I had went to the doctors and said, like, listen, something's going on. I don't know what it is. And automatically I was switched to a medication. Didn't go well, negative side effects. So I switched to a different one. It was fine. It was great. Um, but then I was also put on a medication that essentially made me lose my memory. Like I really don't remember 3 months of my life. Like in that time we got a puppy. I don't remember. Um, I remember bits and pieces, but I remember going to the doctors and my doctor saying, whoa, you shouldn't have been put on this medication. That then created my anxiety with medication, which is a huge, huge, huge thing for me. I don't trust anything that goes into my body. Um, I could go as far as saying things like Advil. I won't, at this point now, I won't take adult Advil. I will take the lowest amount, the most like minimalist ingredients that I can. And I will literally like bite it, see if I have a reaction to it. Like it's wild. Anything that really goes into my body, if it's new or if I haven't eaten it in a while or I haven't taken it in a while, I don't trust it. The other flip side is with medication, how is it going to make me feel? I don't think about, okay, what if it makes me feel better? It's okay, but if this makes me feel worse, like I'm already feeling terrible, I can't afford to feel worse than this.
and I'm sure you
Um,
guys can all understand why it was challenging for us to work together. But also easy and helpful because there's most of what I do is lifestyle stuff and then the therapy and the counseling and the mental side of things. But I'm
yeah,
also a naturopathic doctor who prescribes, and Maddie had some things that did have to be worked on symptom wise and also lab work wise. And it was a
yeah,
constant battle between us of how do we compromise and get her on a treatment where she's going to feel comfortable enough and safe enough to try and do something like an intervention, so that she can get better instead of
yeah,
remaining status quo. And I think that you did work really well on that. Like that was probably your biggest roadblock to
yeah,
getting better. And you did really well with that as time went on.
yeah.
Not that it's not present. So guys, we're not painting
No,
this pretty picture
no,
where Maddie is perfectly healed now.
no,
Like she still
no.
struggles with that stuff. But I think that
Yeah,
we were able to create that safety back in your body that you don't normally have. Like I think that there's this
no,
underlying feeling of my body is going to betray me. Something bad is going to happen. I don't trust what this thing is. It is foreign to me. And
yes,
anything I feel when I interact with that thing, even if it's caused by it or not, is now labeled to
yeah,
being that thing's
yeah,
fault.
absolutely, absolutely. And a big thing for me was, and again, like my parents always said, everyone always said there's no quick fix. But I wanted, if someone came to me and was like, Maddie, this pill will take everything away, I'd be like, oh my God, like this is it.
But you still wouldn't
But
take
then,
it.
but I still wouldn't take it. I still wouldn't take it. And so it was a constant fight with myself of like, I would get on a call with you and I'd be like, okay, this is really good. Like, this is really, really good. And then I would like get off the call and I'd be like, oh my God, okay, like now I'm doing this. And before, years ago, and probably I would say even when I still worked with you, my biggest thing was I would Google and I would Google and I would Google and I would Google
We're gonna go there.
and I would go to the doctors and I would go to the hospital and I wouldn't allow myself to take those steps. Um, so yeah, it was just and it wasn't like an overnight thing. I mean, I still have things where I'm like, oh God,
No, I
but
think you sobbed to me for 6 months straight, being like, everything is bad, everything is bad, everything is bad. And then one day you had this mindset shift where you were like, wait a second, something's different. And I don't know what it
yeah,
is. And I don't know what happened. And I don't know
yeah,
where this happened from. But then things started really rolling for you in the right
yeah,
direction. And that's
everything,
why, yeah, everything. And that's why I
yeah,
tell everyone, stay the course. Like, don't, just because you've tried something once, or you've tried something for a week, or you've done it for a month. It's like, I need you guys to have this mindset of looking forward and saying, I'm going to not pay attention to what the results are next month. I'm going to observe everything that happens. And then when I get somewhere far out, like a bi-yearly or a quarterly, or however you want to look back at it, to be like, whoa, I have grown. And that's crazy. Before we go any further, I'm seeing the chat go wild right now, but
I
I want
know.
I want to make sure that we are all understanding what health anxiety is. And I want to give the definition to you guys, because everyone's got health anxiety differently. And I want
Yeah,
everyone to feel like they have a voice in this conversation. So even though me and Maddie will talk about things that maybe don't apply to you, we're still talking about the same umbrella ideas here. Okay. So if you are someone who does not have the ability to deal with body sensations, like you feel a headache and it's not just a headache, or you have a stomach ache and it means it's something else, or like in Maddie's case, it's like a back pain, oh my God, it's cancer. Like if that is you can't deal with regular body sensations. I've also heard of people saying, oh, Maddie, this is actually going to resonate with you too, with your heart. Right? You guys feel your heart rate, you feel palpitations, and like half of you are running to the hospital, getting your EKG done. I can see it already happening in the chat. You guys are getting Holter monitors. Everything's
yeah,
coming back fine. And
yeah,
it's not enough for you. You're like, no, they missed something, or
yeah,
there's got to be something else that's going on here, because you don't know how to deal with regular human body sensations that we all experience. Like
yeah,
everyone walking on this planet has had a heart palpitation. We've all had a stomach grumble. We've all had a headache. We've all had back pain, hip pain. We've all had weird shit happen to our eyes and our ears, ringing, dizziness. We all get this stuff, but we don't have the ability to tolerate those regular sensations. Okay. That is the first broad stroke of health anxiety.
yeah.
Then I also want to piggyback that with people who have this unwillingness to accept imperfections in their body. So like you are really good at saying to someone else when they have a headache, or they have a heart blip, or they have a stomach ache, or they have diarrhea, whatever you got going on, you can talk them off the ledge, right? They're
Oh yeah,
allowed to be imperfect and they're allowed to have body sensations. But if they're yours, you're like, absolutely
terrible,
fucking not.
terrible. Why is
Right.
this happening?
Right. So if that is you, that definitely puts you underneath the umbrella of health anxiety tonight. If you are problematizing regular human experiences, that puts you under the umbrella too. If you
Yeah,
fear things being way worse than they are. So like what Maddie said before about everything being cancer, having this fixation on every single pain in the body being something worse than it is, or going to worst case scenario, this is probably taking up so many hours of your life. If you
yeah,
excessively Google your symptoms, which I'm already seeing you guys in the chat being like, yes, that is me. Okay. You do not have the authority. And I said this to Maddie very clearly at the beginning in such a blunt way that I'm saying it right now. You do not have
yeah,
the authority to go on Google and diagnose yourself with anything, because you guys don't know what a likelihood ratio is. You don't know what the red flags are that coincide with specific conditions. You don't
yeah.
know how we're going to pull away a diagnosis if something else is present. You have no idea what's happening in the totality of the human body. So if you are going on Google, Dr. Google, you are not doctors. You do not have the authority to make these claims. And if you would not be confident diagnosing a patient with something, do not diagnose yourself. That is scary territory. And
Yeah,
lastly, I put this on my list in my brain, that if you have a fear of something happening with your health in the future, or like having a health scare, or you are changing your behaviors to avoid certain things, then that
yeah,
puts you in the category of health anxiety, because that starts to attack your quality of life. So if you're
Yeah.
in the chat right now and any of those things were you don't even have to say me, but you could say me, or just like give me a thumbs up so I can see how many of you in here fall underneath that entire definition that I just gave.
And I would even go as far as saying, because like I worked in the healthcare field, right? And I would be having a perfectly fine day and hear about somebody else's issues or
Yep.
health things, and I'd be like, oh boy, or I'd be in the hospital for my own issues,
Yep.
and then the Jane Doe next door has like is in like kidney failure, and I'm like, oh my God.
Yeah. I could be in kidney failure today too. There's almost like a
Yeah.
weak boundary there.
Yeah.
Which is I see that a lot. And I want to talk about when this becomes problematic, because
Yeah.
obviously you did all these problematic behaviors and now the rest of the people in here are also doing the
Yeah.
problematic behaviors. But like the stealing of your time, like going to the ER, going to urgent care. Me and Maddie live in Canada. We get that for free. If we want to go to the hospital, that's our time and that sucks. But all of you here in the States, like you guys are paying to go have someone tell you that you're okay every single time. And that is not a reasonable treatment plan. I have another patient in here right now. Her name is Valerie. She's here with us. Raise your hand, Valerie. Say hi. Okay. Valerie came to me and was like, I'm going to work with you and put my effort into peace of mind method in the appointments because I am paying more to go to a hospital every single week for them to tell me that I am okay. And she's
Yeah.
like, and I'm fine, but I can't stop. And that behavior and that cycle and that pattern, it can stop and it can be shifted as long as you're willing to work on it. And Valerie's in here right now. And Valerie, just type a little quick blurb and tell everyone how different it has been since you started working on yourself, just from a bills at the hospital perspective. Yeah, she goes, that's me, $1,300 in hospital bills like per month. That's absolutely insane. She says, I
Yeah.
haven't paid a hospital bill since June. And that's important, right? We have to know that that is affecting our quality of life. That is not where we
Yeah.
want our resources to be going or our time. And in
Yeah.
Canada, as I'm sure Maddie can attest to, how many times she's been in the ER,
Yes.
or she would tell me, she'd be like, I'm driving to the ER to sit outside of it to think about my actions before I go inside.
Yes. I was literally just about to say, like, the amount of times I would go into the hospital, get like registered and everything, get into the room, stay there for 5 hours, just sitting in the bed, and be like, okay, I feel fine now. I'm just gonna go
Yeah,
home.
fuck it, I'm out.
And the doctors are like, oh, like you came in here with like, are you sure? I'm good.
Yeah. Maddie sometimes would go in and send me a picture. She'd be like, my heart rate is 114. Do you think I'm going to be okay? And I'm like, yes, Maddie. I think
Yeah.
that you might be okay. In fact, if your heart rate is only
Yeah.
114, it's going to be okay. But
Yeah.
that's how bad it got for you, was you were obsessing about every vital all the time.
Yes.
Which if you guys, I saw someone write like, oh, I check my stuff on my Apple Watch. Like checking your heart rate all the time on your Apple Watch and panicking about that is a toxic trait.
Yeah.
The only thing you should be checking from your Apple Watch is what's my resting heart rate generally? What's my
Yeah.
heart rate variability? Because that is what gives us a good measure of health. And
Right.
when I do breath work, can I bring my heart rate down? And that's
Yeah.
fucking it. Okay. We don't need to
Well,
know more.
and that's it, right? Like I and I still to this day, again, because of stupid habits, I have like like an oximeter in my purse.
She puts on her finger and she counts
I
her
do.
oxygen
I
level.
do. I'm like, okay, what's my oxygen level? Okay, cool. I'm feeling out of breath. Okay, it's okay. It's 98. And then, and then I got the stupid watch, which this one hasn't been bad. I've been okay with it. But before I would go on and I would see like, oh, my resting heart rate today is 48. Well, that's low.
She'd
That's
come to me and be
low.
like,
That's
I think I'm dead.
yeah. Yeah. So it would go to like one extreme, right? I went to the gym last week and I sent my boyfriend a picture and my heart rate was 165 and I was like, I feel sick. This is terrible. I'm never coming to the gym
And he
again.
was like, that's what your heart rate's supposed to be when you're working out. And you're like, oh,
Yeah. Yeah. And yeah, so it's just like, and again, it depends on the day, right? Sometimes I can talk myself off the ledge and be like, okay, it's good. We're all good. Like it's fine. You feel crummy. And then other days I'm like, holy crap, I'm gonna die. And then other days I'm like, well, if the Lord wants to take me today, the Lord wants to take me today, and I can't stop it.
Yeah, but you didn't have that sense of humor always. You really
No,
worked hard to get there. Like
yeah,
it's such a drastic difference seeing the amount of chill that you have now
yeah,
after working hard on yourself and also hammering home the facts. Remember like the old saying I used to say, facts over feelings, and you'd be like, but I feel like this, and I'd be like, look at the facts, and you'd
yeah,
look at the facts of your vitals and you'd be like, okay, this is normal, like I am good, everything is good, my tests are good, everything's showing this and this and this, but you had a feeling that something was off, and that's what had to be worked on, and we had to stick with the facts and allow yourself to continue going on with your life instead of getting paralyzed like you were. I
yeah,
want to validate everyone right now because I think some people don't understand how they've ended up the way that they ended up. Um, so let's do some like background history questions that I would usually ask someone if I was working with them. Because some people get health anxiety because they've had personal health scares, right? That's valid. Where
yeah,
someone has let's say you're young, you have a heart attack, and then after you're like, oh my God, I have to focus on that all the time because that was scary for me. Or
yeah,
some people go in and they get their heart done and they see that they have mitral valve prolapse. And then that causes anxiety because now they know that they have a heart condition, or people who have been diagnosed with cancer before and then are in remission and live the rest of their lives being health anxious about every little symptom, right? And there are some of you in here that have had that experience where you've had a reason to end up where you've ended up. And then for you, you also mentioned at the beginning of your story that you were incorrectly medicated, which made you anxious
yeah,
about your health.
yeah,
It gave you this distrust about the entire way about going about this. So
yeah, the entire system. Like I didn't trust you. I didn't trust my
yeah,
like, and a lot of it, and I don't know, it probably seemed like it to you. I know it seemed like it to you, but there would be times where I would almost much rather a doctor say, yes, you have this,
right. Because you
than
wanted the reason. You didn't
I
want it
want,
to be about anxiety.
yeah, yeah. Like I was like, okay, but then I sit back now, I don't want some
Right.
hole in my heart or like,
Yeah.
right? Um,
Which did take us some work to do cognitive behavioral conversations around, because I think I had to ask you that. I said, would you be happier if you had hyperthyroid? Would you be happier if you had a brain tumor? Would you be happier if you had like chromocytoma, which is
yeah,
a tumor on your kidney that's going to cause all these anxiety symptoms? So I said that to you and you were like, no. And I was like, so why are we wishing for these
yeah,
results to give us something? I see people out there all the time being like, oh, I should test for mold poisoning or I should test for parasites. And I'm like, why are you guys trying to find reasons to be sick instead of
yeah,
saying, okay, I can actually tackle this differently and have my symptoms go away without pretending that I have a disease that I may not even have through
yeah,
some odd testing that's going on out there these days. And
yeah.
then you weren't going to do the treatment anyway. So who fucking cared? It was like, I
Well,
wanted to do it.
well, and that's the thing, right? Like, talking about like the thyroid, right? It seemed so close and like, okay, maybe that's what it is because my mom had like recently been diagnosed and like, I'm like, okay, this seems right. And then you said, okay, we'll take this. And I was like, okay, I spent what, over $100 on it and it's still sitting in my bedroom.
Yeah.
I think I smelt it and was like, ew, gross, right? But even when I bought it, right, it was still up in the air of like, okay, you could have it, you could not have it, it could help you, it could not help, like, you don't know, right? But I was still not willing.
Yeah.
There was no willingness to do that.
Yeah. Because the fear was too strong. And
Yeah,
that's why I tell people like we have to find a happy medium to work together. It can't always be like my way or the highway. Because obviously you
Yeah.
guys can understand that I wanted Maddie on like 6 different things to fix all these issues. And I wanted her to do everything that I said all the time. But she was coming back to me saying, okay, well, I'm not willing to and I can't. So how do we negotiate? And I'm like, great, let's have a negotiation. And I think a lot of
Yeah.
doctors from the other side just say, well, I can't help you if you're not going to do what I say. Instead of
Yeah.
saying, okay, I recognize that these are your roadblocks. How do we work around them? How do we work with them? How do we get you a little bit closer to the goal? And I think that that flexibility, especially when it comes to anxiety, is paramount. And then with health anxiety, you guys are dealing with such unique things that normal people don't have to deal with. So I don't think people understand when you say, I can't do it, a normal person's not going to be like, oh, yes, that makes logical sense. They're going to be like, no,
Yeah.
I don't get that. Just force yourself to do it. And that's not the right way to approach a patient. So I want all of you guys
Yeah.
to know that if you've ever been, I'm going to say the word and it's going to run wild today. If you've ever been medically gaslit,
Yeah.
find a practitioner that's going to work with you because it makes the world of a difference in your treatment plan. There is no one way to do anything. We can always find a new strategy to work around things. So that's why I do not like when you guys say, I've tried everything. I'm like, no, you haven't. There's always something new to do. Okay. I want to keep going with the validation list because I see there's a whole chat happening in this chat that me and you are not even reading. We're going to have to stay
I
after
know.
everyone goes
I
away to read it.
know. I
Um,
know.
so the next thing I wanted to talk about is sometimes people get health anxiety because they've been neglected in childhood. And this one's actually not as rare as you'd think, because you're
Mhm.
not being taught the skills on how to cope with uncomfortable feelings inside your body, and you don't have anyone to go to. Is there anyone
Yeah.
else in that boat here where you were kind of neglected and left out on your own, and now you're just like freaking out inside your body because you don't know how to tolerate anything? Yeah. Okay. That's
Yeah.
that is a very real thing.
And you know what? I wouldn't say like, yes, that sucks, right? I wouldn't say it's the worst thing, right?
No,
Like
no,
I,
because it teaches you an interesting skill in its own way.
yeah, yeah, like I think about, my parents, right? And my mom always says to me, always, and it sounds harsh, and mom, if you ever watch this, I'm sorry, but uh, my mom always says to me, if I'm like, oh, I feel this or I feel like that, she's always like, Maddie, you're not special.
Your mom's a hard
Like,
ass. I love Maddie's mom though.
yeah,
She's hilarious.
yeah,
However, you also had a balance and your mom and dad obviously did care for you. And I think that this is
yeah,
more about people who are like legit neglected and weren't taught the
yeah,
skills. Your mom did give you the hard skills. And then your
yeah,
dad also from the other side is my next point here is
yeah,
some people get health anxiety because they have this helicopter parent who's constantly being like, oh, wait, oh, did you? And you're always hyper vigilant about the thing that you're feeling.
yeah,
And I think that a lot of people can resonate with that type of parent where it's like, you're like the bubble wrap child. And
yes,
you start getting concerned because they're not okay with feeling anything and they're not okay with you feeling anything. So then that means that you can't actually be okay with anything. And that is not a
yeah,
great skill to learn in childhood.
yes,
But that's why we would love for our parents to go get their help before they, they ruined
yeah,
us, damn it. But that's
yeah,
fine because that's happens all the time. And we're all about to ruin every next generation too. So it's all good.
yeah,
What goes around
yeah,
comes around. But these are some of the answers and the reasons why we end up where we end up.
yeah,
And then the last one that I want to say, and I know this is happening in the chat right now, so I got to address it. But some people have a health scare that happens with someone really close to them. And they feel that they are vulnerable to that thing because they've been around it so much. So I do
yeah,
have a couple patients whose parents have passed away and they were caregivers of that parent and they saw a lot of things. And now they are constantly worried that they're going to end up there or that what they have could potentially become that. They worry about being a burden on someone else and all the shit that that's going to come along with. So I think that that just needed to be said because that can create health anxiety even later in life. Not all of us are
yeah.
born with the anxiety or the health anxiety, but it can be created in a traumatic type of situation. Don't want to overuse that word, but a lot of people who have very close relationships with people who go in tough ways, or they're dealing with people medically, it's challenging. Like the same way that when you were working as um, what were you? And you weren't a nurse, but you were like doing, you were like taking care, like as a primary
Yeah.
point of contact
Yeah.
with all these people at the long-term care facility. So you were
Yeah.
constantly being exposed to like the worst of the worst, right?
Yeah.
Yeah.
Yeah. And it was hard, but it was even harder dealing with the families, right? Like it's just a different um
It was health anxiety plus feelings.
yeah. Yeah. It was like you can't be cold to it
Mhm.
because that just won't work. But you can't be so close to it that it affects how you work, right? And it was affecting how I worked. And then I would go into the bathroom and I'd be like, oh God,
Yeah, panic attack.
Betty, who had Alzheimer's,
There was
now I
one
have.
time there was one time, guys, that Maddie had a panic attack at work and we had an appointment. She was like, I need it last minute. I'm like, I'll fit you in the schedule. And I think you had the panic attack in front of me and we did like a full shake it out. I let you turn off your camera and you did full panic attack, shake it out
Right.
routine until you regulated yourself before going back to work because I'm like, you are not
Yeah.
leaving. You are not letting this take your day from you. You're going to process it and you're going to move through it and you're going to face it.
Yeah.
And that's a skill and a tool that it's it's really invaluable. You can't even put a price tag on what it means to be able to work through that level of discomfort. And I get activated like that all the time. And I have to work through it because I refuse to let this thing dictate my life. I want to be able to, in like, let's say a situation where Maddie was, have a panic attack and keep going, and, have a feeling of high emotion and anxiety and feeling like this is it. This feeling is encompassing my entire body and it is everything right now. And there's no other way that it could be except the way it is now. And then work through that within 5 to 10 minutes and be like, okay, feeling very different. And recognizing the temporariness of that is just an unbelievable tool.
Yeah.
I'm
Yeah.
just Ninka just wrote, holy hell, my anxiety is just rising. That's okay. Sit with it. You're literally in good hands right now. You're with a massive group of people who all know what it's like to totally freak the fuck out. And we know how to sit with it. It doesn't mean we don't get crazy. Like Maddie still gets crazy. I still can get crazy, but we know
Yeah.
how to work through it and not let it impact the rest of our day, week, month, year, relationship. Like everything can't be impacted by the experiences you're having. And
Yeah.
I want everyone to remember this very, very importantly. Is health anxiety is like a symptom of anxiety. Everyone who has health anxiety, it's kind of like the same as social anxiety or like performance anxiety. We're just labeling this now and saying it's health anxiety, but the anxiety cycle is exactly the same. The trigger and the fixation is just on that specific thing. And
Mhm.
we have to still regulate our nervous system the same way that I would regulate anyone's anxiety in general, so that the health anxiety symptoms lower. There's not like a special type of treatment that I do for people who have health anxiety. It is everyone who has anxiety has a difficult time feeling uncomfortable. And we have to increase our tolerance to discomfort. We have to learn how to be with ourselves and sit with ourselves. And as that muscle gets strengthened, plus we do the nervous system regulation at the same time, which is what we do in Peace of Mind Method. Maddie kind of had her own build your own blocks of how she did the program because Maddie is stubborn and needs, let's call it extra help. But we still have to remember that when we're doing the overarching stuff for our nervous system, the health anxiety symptoms come out less. They are just a presentation of what's happening inside. Your body is latching onto it and saying it's that thing. It could literally be any other thing, but your
Yeah.
brain is just going to the health piece. So I don't want you guys seeking out like special care for health anxiety or be like, tapping for health anxiety, breath work for health anxiety, yoga for health anxiety.
Yeah.
It's all the same shit where
Yeah.
you need to just be able to learn how to be with yourself and recognize how you're going to soothe. And I think that that's the biggest missing piece for all of you who struggle with this is you do not know how to soothe and process and regulate in real time. Most of you are not doing anything on a day-to-day basis. That was the case for Maddie. Maddie was like, she was basically doing, what's it, everything but the kitchen sink or everything under the kitchen sink? What's the idiom?
I don't know, but I wasn't doing shit.
She was just like mashing shit together, being like, I'm doing everything for my mental health. It's this, this,
But
this,
I
this, this. And it was
but I
nothing.
wasn't but it was nothing.
Yeah. So that's what I want everyone to just have a moment where you're like, okay, what is my plan? What is my daily plan that I do frequently in order to regulate myself so that this symptom that I'm thinking is the problem, it's not, it's a symptom. The symptom is coming out more. And that root cause really is, how do I learn how to regulate myself, soothe myself, be with myself, be comfortable inside my skin? Because that's kind of what health anxiety is this discomfort being inside your body. You're not allowed to feel these things. You're not allowed to have imperfections. You're not allowed to feel bad. You're not allowed to have any symptom, because the second that you feel a symptom, there is something wrong. And that is not the case. Okay. Throughout the day, your body should feel a whole shit ton of things. And that's the point of being alive. And I think that that's something that I hammered home with you a lot in our appointments, which was, you are having the human experience. And if you keep trying to remove the human experience from yourself, you're basically wishing yourself dead. And you don't want that. Because then on the flip side, remember when you stopped feeling anxiety and then you were like, now I'm anxious about not feeling anxious. And now I don't have the anxiety, and what's happening and who am I and what's going on? And this feels weird.
Yeah. It was to both extremes, right? Like I would have such intense anxiety that I would come to you and I'd be like, I don't even remember what just happened. Like I remember at one point I sent you a video of me and I was just like,
and then you were like, am I having a seizure? And I was like, I'm
like,
no, you're tired from having anxiety and you're probably dissociating.
Because I was exhausted, and literally from the moment I woke up, I was like, zing.
You're like hypervigilantly looking for everything to go wrong.
Yeah. And I would literally open my eyes and I would feel so uncomfortable. I would get up, get ready really quick, and go to work, because I was like, I just need to get out of here. Because if I lay in bed and relax, and that was the other thing, is that I was so upset that I couldn't relax.
Yeah, you were constantly trying to crawl out of your skin.
And I was working every day. I went through a year and a half. I never had a day off. I didn't take a day off. I would have gone into work and not been paid to not.
So that you didn't have to sit with your shit.
That I didn't have to sit. Yeah. So that, like, literally. And now it's crazy because again, I stepped down from healthcare. I went into a job that was very low stress. And funny though, because I had moved back home, had a huge shift in my life. And I had told myself, I'm giving myself a year at this job. I'm giving myself a year to come back down to ground zero and figure this out, because I can keep going on this, like,
the hamster wheel. You were running from yourself, essentially.
Yes, essentially. Yes, absolutely. And pretty much a year to the date, I started my job now, and I have my weekends off and I enjoy it. I'm in a great relationship. My relationship with my family is better than ever. Does that mean that all my anxiety and my health anxiety and stuff has gone away? No.
But it's very manageable, is what
it is so manageable, to the point where I'm literally sitting here and I can't think of the last time I was at the doctor's. Like, I actually can't think of it.
Yeah. But this is why I wanted to have you on here. Cause Maddie, like all of you are right now being like, how do you work? How do you do this? How do you get over this? How do you get through that? She just said to herself that she was going to put her nose down and do the work and not overthink it and stay committed to that. And she's sitting here on the other side a year later being like, everything is very different. And when you stop staring at the problem, it's kind of like, okay, I'm going to give you a terrible, gross analogy. We all have dogs, right? Everyone has a dog or a baby in here, right? Say I. Okay, when your dog or baby takes a shit in the room, you don't just like stare at it and go, oh my God, there's a shit, right? You go, okay, that was unfortunate that someone shit in here. Okay, we're going to clean it up and we're going to do what it takes to make the room look a little bit cleaner. We're not just going to stare and point at the issue. And then there might be a conversation of, hey, did you maybe want to let the dog out before they shit? Or how long have we been gone from the house? Or, maybe the child didn't have to poop in the corner, but if someone was paying attention to it, that maybe it wouldn't have happened, right? So there's all these things that we want to start looking at instead of looking at the shit in the room. And I think Maddie, like specifically in your case, you wanted to fix the health anxiety so bad. And you're like, how do I get through this? How do I get over it? How do I make it different? And I said, we're going to stop looking at it. And we're going to stop beating it like a dead horse. And instead, we're going to put our effort over here. And we're going to change how you're interfacing with yourself. We're going to revamp your life. We're going to implement some, regulation tools and processing stuff. For you, it was more of the thinking side of things.
Yeah.
That needed to be cleaned up. And everyone has their own different shtick that they do that they need the extra help with. But when we stop staring at the shit in the room for you, then you were like, that's interesting. My symptoms have changed. And that's when you had this aha moment of like, wait a second, I was fixable. I'm not crazy and unrepairable. I can actually be that thing and still have anxiety and still be me and still be quirky and still be bubbly and still have a ton of energy and also be loopy sometimes. But that's all a part of who I am. And I like that, instead of needing to change who you are all the time and then coming down on yourself for having all these failures. And I think that you just like lost sight of all of that. So it was definitely an interesting path.
Yeah, and it was intense. Like I won't even sugarcoat it. Like it was, and again, like we could go back and say like, yeah, going to the hospital in the States, it's a lot of money and things like that. But I was so far gone.
I know. Oh my God. We're going to talk about those. I actually left myself a note to talk about you being so far gone. You want to go there now?
Sure.
Let's talk about the crazy shit you used to do.
Wait, okay.
Who in here feels that like that they have to get reassurance because they cannot soothe themselves? Can someone please write in the chat if that is you? And like you can't be satiated. It's not like you're going to get the answer and feel good, but just you have to keep going. And you're like, but it's going to be okay, right? Like everything's going to be fine, right? Like you need to talk me off the ledge. Okay. Maddie used to do this thing. And me and Maddie first started working together. And she was like, how are you going to help me? I said, I'm going to change your behavioral cycles. Because if we don't change your behavioral cycles, we're not going to stand a chance here. And she was like, but I'm someone who needs a lot of reassurance. And I said, that's noted. I'm not going to be giving you reassurance. And she was like, well, how are you going to help me then? And I said, watch. Okay. So Maddie used to do this crazy shit where all of you who are in here, if you're my patients, you know how like quick I am to answer your text. If you guys have a question, if you guys have something you need to know, if you have a question about your treatment protocol, I'm fucking there, right? Maddie, I said, oh, you have an issue with reassurance? Kaylee just goes, within 24 hours. For Maddie, she used to call me on repeat and text me saying, Jenna, I need you to pick up. And I would ignore her calls and I'd text her back and I'd say, you don't need me to pick up and I won't be picking up. And she would have to sit there and rifle with herself in her shit. And I would say, go do the technique, come back to me. And she'd go do it and she'd be like, it's still not working. I'm like, you didn't do it. And she'd be like, I know, but I couldn't. And I'm like, go do what you need to do. You need to be able the same way. And I love these analogies about animals. And I've probably said it a bajillion times and you've all heard this, but I'm going to say it again for dramatic effect. Okay. Butterflies cannot become butterflies if they don't rifle in their cocoon as caterpillars. If you break the cocoon and let them out, they die. If you take a baby turtle from its nest and you walk it to the water and it gets in the water and you think that you've helped it because it was struggling, it dies when it gets to the water. And I said this to you. I don't even know if you remember me saying this to you, but I said, I have to let you struggle. I have to let you go through this. I'm here. I'm here for you. And we're going to talk about it and we're going to process it. But I'm not going to give into your urges because what we're trying to do right now is break your cycle. And Maddie allowed that to happen because of how closely she did work with me. Sometimes I have to get people like their partners to get on board. Like I do remember having a patient. Yes, this was someone who was in Peace of Mind Method this year. She used to do this reassurance. She had the cycle with her husband. I said, listen, this is what I want your husband to do. You're not going to want him to do it, and you're going to beg and plead for him not to do it. But this is how we're going to break the cycle, because we have to build strength and tolerance and understanding that you are there to save yourself. And Maddie did not fucking like this. By the smile on her face right now, she's sitting here being like, I remember this. Like, it was not fun. And she
It was.
probably wanted to curse my name to the wind most times that I
Yeah.
didn't pick up. And then 6 text messages being like, I need you to answer. It's an emergency. I said, are you dead? And she'd be like, no. I'm like, it's not an emergency.
It would truly feel like in the moment. And it sounds so selfish and so unhinged, but like, whatever. I was like, how dare she?
Yep. The entitlement, the abandonment, the trigger, the pain, the how can this person not help me?
Yeah, like I would be, she
Almost
would
just made a
message,
joke.
she, she would message me and be like, Maddie, I'm in appointments. And I would be like, I don't care. I don't care. It was, it was like all of my senses were gone. It was like, Jenna, I am literally having a stroke. I can't feel my body. I'm sitting in the hospital parking lot. So you're telling me that you don't care? Is that
And
what
I'd
you're
be
telling
like, and I would say to you, no, it's quite the contrary. This is exactly why you're seeing me. We're trying to shift these behaviors. So I'm going to hold
Yeah.
you accountable. I'm here to lean in, but I'm not going to give you the satiation that you're looking for, because that is an impossible hole to fill. And the interesting thing is, you can only do this with someone when you have a therapeutic relationship with them. Obviously, Maddie in the moment was like, fuck you. I want to fucking kill you. I hate you. You're a terrible person. You're a mean doctor and I don't like you. But then next week she'd book in and be like, okay, I need to chat. Right. Because there was a foundation there between us that she trusted what it is that I was pushing her through to get out on the other side. And I think that it does take a proper medical doctor-patient relationship to do that type of work, because there's a lot of situations where practitioners buckle under pressure. They give in to the making their patient happy because they don't want to be seen as bad or not helpful, or, you know, fearing Maddie going on social media being like, Jenna's the worst doctor of all time. She did this to me. But like, if I can say one thing about Maddie and me, like, I've seen her at her worst, and there is like big love that comes out of her heart when she gets to look at me and be like, you were right. Fuck. Right? Like she has this moment in her brain where she goes, that's exactly what I needed. I didn't want it. And I go, I know it's not what you wanted, but it's the strength that you needed to build to be where you are now. And if you're not given that opportunity without also working with someone who's going to self-regulate your behavior and your emotions, right? When you do it to a parent, or you do it to a partner, or you do it with a friend, there is that abandonment feeling of, you're a bad person. But with me, you knew that there was a reason that I was doing it. And I think that that's what allowed you to kind of go, this is so gross and I have the biggest ick right now, but I'm willing to lean into the process of what it is.
Yeah. And that was pretty much it. It was like, you either, and I would say it was a good mixture of the medical side, right? Of like working with what was going on in my body. Because again, we could go back to a year and a half ago when I was like lowest of lows, and I was dropping like what, 1 to 2 pounds a day, it felt like.
Yeah, you were withering.
Like there was nothing left of me. My clothes didn't fit. It was like my confidence was gone. I couldn't eat, so I wasn't nourishing myself. So that mixture of the medical side and the get your shit together was everything I needed, because now, like I even tell people to this day, like, you don't understand, like my naturopath isn't nice to me. like, like she is not, she's not that you're not nice, but like,
No, I totally get what you're saying. I'm a savage.
yeah, like you will be like, get your shit together.
Yeah,
Like,
I'll be like, you're wrong. Get your fucking life together and let's go. Make the moves.
yeah,
Look at yourself in the mirror and face yourself.
yeah,
That's what this
yeah.
is.
And it was exactly what I needed to trust somebody without them coddling me or being like, it's gonna be okay. It's gonna be okay. You were like, you better do the work or else we'll just continue on this path. And the flip side of it is, yes, obviously I did work to get here and things like that. But I also probably would have been here a lot faster had I like
Were you gonna
gotten
say
it.
listen? If I listened,
Yeah,
I would have been here faster.
but even now, like I mean, we haven't had an appointment in a while, but even now you'll be like, okay, yeah, I think you're ready. Like, let's start that. Well, I haven't started that. In fact, that medication that you told me to start, I gave to my boyfriend last week.
Is he doing well?
He's doing great. Um, but yeah, so it's like, okay, I know I want to do this. I know I might have to do this, but maybe I'm gonna do it on my own terms. But I can't be upset with you if it takes me 3 extra months to
Yeah.
get there, right?
And I think
Um,
that the thing with you is I always recognized that you knew what I was saying. And you knew that you're the roadblock and you were okay with being like, okay, it might take me longer. I might be more resistant. I might take 3 tries to get me to do something. And I've got lots of patients like that. And I never lose patience with my patients. That's something very unique about me is you guys can come to me and be like, I didn't do what I said I do. And it's like, we're going to crack jokes anyway, because we have to have that fun, loving interaction to then also on the other side of the spectrum, me to look at Maddie and go, get your shit together. Get the fuck out of here. Right?
yeah,
Click and
yeah,
and call. But
yeah.
it's what's required.
And
And just
and
be
and it's crazy because I remember the multiple conversations we had at the beginning where I was like lowest of lows. And I was like, Jenna, I'm gonna be your patient that dies.
I
Like
know, I
I'm
remember
gonna
that.
be the one I'm gonna be the one you can't fix. Like what? Like I was so fixated on like, so what are your stats here?
Yeah.
Like, what race do you
How many patients have died under your care? I
yeah.
was like 0.
Yeah. But the health anxiety and like the health anxiety about my anxiety,
Yeah. You had
right? Like,
anxietyception for sure.
yeah, like I knew my anxiety was creating my health anxiety, creating these sensations and emotions and things like that. And now my heart skips a beat and I'm like, whoa, okay, we're
Yeah,
good,
exactly.
right?
But before it was not. That would like spiral you throughout the day. And it's
Yeah.
so important
And
for you to
yeah,
reiterate that for everyone to hear.
yeah,
So obviously what I teach people in Peace of Mind method is how to sit with their shit. If you guys didn't pick up on that one yet, which is what me and Maddie worked on. We did it in a more creative way because of the roadblocks that she had. But mostly when I'm working with people, we're learning that skill through meditation. We're learning it through breath work. That's how we're regulating. And Maddie you were good with the breath work. You were also good with the physical side of like moving things out of you. That was never anything that I was worried about. You were more of
yeah,
a, I can't do some of these things because I refuse to. So with most people, it's the meditation, the breath work, the yoga. Yoga is huge for people to learn how to deal with discomfort. Maddie was resistant to doing a lot of that stuff. I don't know where you're at now, but I do know that that's like the hallmark and like the goal and the gold standard for most of the people in the program. Rachel just said, say it louder for the people in the back. I'm not going to yell at you from over there, but I'll give you a live wink. So doing those things, practicing non-judgment and observation was so pivotal for your journey instead of the spiraling. So like you observing something as it was and then being like, okay, like you just said with your heart rate, my heart rate's allowed to skip a beat without it meaning something. And we had to get in between that with certain cognitive techniques. And that's like, it also ties into the cognitive distortions I teach in the program, right? Like for you, that would then tell a story for the rest of your day, for the rest of your week, for a part of who you were. It would like
Yeah.
activate a core belief. And I think that organizing all those things was so important for you. So I think that you were more integrated in the program than you think, just because of how often we did the work. I was still doing the program on you. I just couldn't
Yeah.
force you to do the meditation and the yoga, but you did
Right.
everything else quite religiously.
Yeah. Yeah, for sure.
And all that's to get you guys to a place where you can self-soothe. And like Maddie is living proof sitting here right now that you can do that. Okay. So I want to ask you a few things. We've been together for an hour and I don't want to keep anyone for too long, even though I'm going to let you guys talk and ask your questions. But I wanted you to say what the best skill is that you learned when you were working on yourself.
Um, I would say trust in myself and you, because the minute I stopped trusting the process or not trusting myself or not trusting you, it was, it would go crazy. But the minute I would bring it back and say, I am in good hands, I know Jenna knows what she's doing. I know if she felt like anything was going wrong, she would tell me. I know she's not going to lie to me. And I trust myself enough that I will get better and that there is light at the end of the tunnel. And not to say that like bad days won't happen. That's very normal. I mean, people who don't have anxiety have bad days. But yeah, I would say just learning to trust the process and trust you and myself.
That was a great answer. I wanted to also tack on to what you said because that was like more emotionally and intellectually what you learned. And I realized along the way that you also learned a lot of science and you learned a lot of medical information and you learned, at least from all the appointments that we had, I felt like I was teaching you about the human body and how it functions so that you gained that trust. And I think that that
Yeah.
is something that's missing in a lot of people's treatment protocol with health anxiety, is that no one's taking the time to sit with people and teach them what's a red flag, right? If you're going to have cancer mysteriously throughout your body, what are the 5 signs that we know that have to be present in order for us to take this concern seriously, right?
Yeah.
And learning that for you, it was so much easier for you to organize in your brain and be like, okay, I don't
Yeah.
have that. Or when it came to the thyroid, you were like, okay, well, if I had a thyroid condition, those symptoms would be coming out before this random little thing that I found that kind of matches the thing on Google.
Yeah.
And that knowledge for you, I think, got stronger over time. And that also allowed you to have more trust in your body, being like, I'm smarter now, body and mind. And I
Yeah.
think it allowed you to feel safe. And
Absolutely.
obviously safe with me. Like I want you to have that. And I want everyone to have that in a doctor-patient relationship. But I feel like you were safer alone at the end of the day too. Like not just under
Yeah.
my supervision.
Yes. Yeah, absolutely. Absolutely. 1000%.
Okay, my next question, you kind of already answered it, was what do you wish you gave up sooner from your bad habits? Like, what do you think slowed your growth the most?
Honestly, I feel like I always say fear, because the fear and the lack of trust and the unknown stopped me from sitting with it because I was uncomfortable and I didn't like for instance, let's talk about the magnesium, right? I was like, am I gonna feel so sleepy that I'm gonna like fall asleep at the wheel if I drive late at night? Right. But it was the fear of what is going to happen next and what is my next step if this doesn't work. So a lot of it was I wish I let go of that fear sooner and like let myself do the work, rather than like just thinking about it.
I'm going to ask a question because Maya just wrote in the chat, how do you get rid of fear? And Maya's in Peace of Mind Method. And Allie's also in Peace of Mind Method, who just put the arrows up. And they want to know how you got rid of it. And what I want them to know, and what I want everyone to know, is you can't force fear away. It's one of those situations where you can only believe it when you see it. When you put your head down and you do the work and you keep leaning in and you stay consistent and you keep showing up for yourself, the fear starts to dissipate and you don't realize it.
Yeah.
And, you know, you can't, like, Maddie's looking at herself right now being like, I wish I got rid of it sooner. But what she also recognizes, and I know that you know this, is that you couldn't change that. You had
No.
to go through this in the sequence that it happened for you to get where you did. And that's
Absolutely.
why I have blind faith when I work with people. And I don't say I know how to fix you. It has nothing to do with me. I provide the tools. I have the conversations. I'm not magical. I told Maddie that from the beginning. I said, I'm not going to do magic shit. I'm not going to do woo woo. I'm not going to come up with something that never been came up with before. And I'm not special. But what I'm going to do is I'm going to keep you with your head in it, because that is where the magic happens. And that's my advice to everyone who's at the beginning of Peace of Mind Method right now. And that is where I see all of you ending up where Maddie is. Valerie wants to know, how did you get over the fear of taking the supplements that I wanted you to, and the fear of what might happen when you took them?
I haven't.
She hasn't. She still works through it. But you also,
Yeah.
we used to do really low dosing for you. So why don't you tell them about that and how we compromised?
Yeah. So, again, like I'm talking low dosage. Like I would like put it on my tongue and I'd be like, okay, that's enough. Um, I would say it would get to a point that I was ready. Like I was like, okay, I have the mental capacity to allow this anxiety, because I knew that new anxiety would come in, but I now have room in my brain to allow that anxiety to happen and work through that. Um, because when I was at my peak, there was no chance. I was like, I mean, some people can just like take
Yeah.
anything and everything. I'm like, what's this gonna do? Um, and yeah, like I would say there are still some fundamental things
Yeah.
that I still don't take. That maybe I would be even better. I don't know. But
It's a
in
mindset thing.
it's a mindset, and in the deepest of my heart, I have to be content with where I am right now. That maybe in a month or two, I bring that in. But
Mm-hmm.
that is up to me,
Yeah.
right?
So like the
If
agency.
yeah, if I'm as long as I'm content, like I don't think about it. I don't think about you telling me that I should be taking ashwagandha. I
Yeah. And
don't
then
think,
you feel like a failure because you didn't. Like, it's not on her
yeah,
mind.
it's not on my mind. It was because I would have all these things on my bedside table and I'd be like, oh my God, what is happening? But I got rid of that and I was like, okay, in time, in time. You could do this in a week, a month, in a year, 5 years, whatever. Who cares?
And also, you did do the thing where every single day you'd be like, today is the day that I'm going to try. And
Yeah.
you would address every single day as if it was new, and that today that you were capable and possible to do that thing, instead of building a fear around the supplements. You're not afraid of them. You just think to yourself, maybe I don't need them and I don't want the inconvenience. And I'm also feeling kind of better, so I don't really want to go there. And
Yeah.
that's more of your mindset. And you did do stuff like lowered the dose. We did do stuff like you would like put something in your mouth and then be like, you know what? I'm not feeling like that's going to feel safe for me today.
Yeah.
And then we tried liquids and we've tried powders. Like we've done different things in order to administer things to Maddie so that she felt safe and comfortable.
Yeah.
And that flexibility can be taken with any of my patients. It's not like I only do that with you.
Yeah.
Other people, you guys get the courtesy too. So if you want to try and doing something differently, that's always an option. I don't think there's one way to do anything. But
No.
then there was also things for you that were critical, like the potassium was critical and you were consistent with taking it.
And I still am,
Yeah.
right? Like I think it was, I don't know, probably like 2 weeks ago. I said to my boyfriend, I'm like, huh, like my heart feels weird and like I'm crampy, like my legs are crampy. And then I looked at him like, mm, I've been at your house for 5 days and I haven't been taking my potassium.
Mm-hmm.
And then again, as soon as I start taking that, it's like, okay, that's what my body needs. So
Yeah.
yeah, there are things,
That
right?
you
Like
feel safe with.
that, yeah, like vitamin D. I mean, I don't really take much of that anymore
Yeah.
because now that again, things like that, I was low on vitamin D for years, for years. And the consistency of it, I'm at a great level, I'm good. I'm like, okay. So that's my answer is if I want to change something, I have to be willing to
To
put
do
in
it.
that consistency.
Yeah.
Um, but it's okay if you don't want to do it. If you're not ready, cool, whatever. But you have to be content with that.
Yeah. And there's also a way to work on your mental health without ever putting something in your mouth, guys.
Absolutely.
I say natural medicines are nice to have. Medication's a tool. Natural medicines are a tool. The other things are non-negotiables. The way that we treat ourselves on a daily basis, the way we talk to ourselves, the things that we engage in, the routines that we have for ourselves, that's the mainstay of our anxiety and our depression and our mood and how we interface with ourselves. Everything else is a tool. And I don't think that it's going to make or break the treatment plan. So I'm not like, I'm probably anti-naturopathic doctor saying that. I'm definitely anti-functional medicine doctor saying that. But I just think that there is so many other ways to do this. And if one part of the picture doesn't work for you, why are you going to shoot yourself in the foot and say, well, if I can't do that, then I can do nothing? It's not the truth. Like
Yeah.
Maddie did this so uniquely. And she ended up in such an amazing place, which is I saw it for her from the beginning. So I had no qualms with how she wanted to get from point A to B as long as she kept coming and showing up in the ring with me and then we could do a little boxing match together because I knew that when I had her in my sphere that we were going to be able to see those big changes. But if I said to her, sorry, I only work with natural medicines and that's all I can really offer you, so I can't help, like she wouldn't be where she is right now.
Yeah.
And that's why in Peace of Mind Method, I do all these different things. I take from all these different places. I turn over all the rocks because natural
Yeah.
medicines are not the pinnacle of everything. And
No.
neither is medication. You can be on medication and not feel good. And that was Maddie's exact situation.
Yeah.
Okay. So I feel like I can open up the floor for Q&A if anyone has any. Me and Maddie can try scrolling through the chat. I want to leave you guys something because I'm trying to answer Maddie in between when I'm talking and then you're talking. But if you do want to book a call with me so that we can discuss Peace of Mind Method and see if you're a good fit, that's the link right there. Okay. Nobody type. I'm going to leave it again right at the bottom. Can I pin this? No, I can't. Okay, that is the link if you want to book a call with me. You're going to look in my schedule for the next few days. That is how we are going to chat and see if you're a good fit for the program. Not everyone is. Okay. And that is not something that I'm shy with saying. If I think that you are, more advanced in the program, I'm not going to tell you that I think it's going to be helpful for you. If you are totally dysregulated and I don't think that you have the ability to do the things that I'm asking, I'm not going to say it's for you. But let's at least have a conversation and see where you're at so that I can provide the best options for you moving forward. Okay? Do we have any questions? Good night, Allie. Bye, bye, bye. She says all of a sudden getting anxiety. And you know what? It happens. I've been feeling my anxiety flare up for the last 2 weeks, doing nothing. And I'll catch myself moving so fast and like clenching my teeth. And I'm like, whoa, boy, slow down. So it's so interesting to obviously have this as my job, which I work with people on it all the time, and then also have it myself. So I don't want you ever to think that I am fully healed either. Me and Maddie gave you a very raw, real example of what it looks like to go through this stuff and work on your mental health. And I hope that you guys learned a lot. I will be sending out the replay tomorrow. Maddie, you're going to go viral. Just kidding. But thanks for your consent. Thanks for your consent of having this conversation and letting everyone hear your story and, watch your growth. I think it is inspirational. Just because everyone just like you thinks that they are the worst of the worst and the worst patient that I could ever have. And they're unfixable. And like, you're a perfect example of someone who can be on the other side of this.
And I mean, at the end, you did say I was pretty bad.
Mm-hmm.
I was
guys, she was terrifying. I will send you guys the recording tomorrow. I'm going to upload it to YouTube tonight if you do want to give it a rewatch. But thank you for joining us. Thank you, Maddie, for joining me. And I hope everyone has a lovely night. If you did not book a call with me through here, but you do want to have a further chat with me, send me an email, send me a Facebook message, send me a message on Instagram, and I will answer you, like one of my patients said, within 24 hours, okay? I will get back to you and we will have a good chat. All right, folks, have a lovely night. If you're in Australia, have a lovely day, and I will speak to you all soon. All right, ciao for now.